related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Appt.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us at 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today, I am excited to introduce everybody to Dr. Zaki Moyenda. And he's right here locally in Lake Worth. The address is 220 South Dixie Highway, Suite 4, Lake Worth 33460. You're going to want to write his phone number down. It's 954-774-1414. Welcome to the show, Dr. Moyenda.
Thank you, Louise. Good to see you again.
Nice to see you. I appreciate you taking time out of your busy schedule to share with us the updates on your office as well as what else is new in the healthcare industry. So we appreciate you for coming on.
Well, thank you very much. It's a pleasure to be here. And as always, I'd like to thank All County Home Healthcare and the staff, the leadership there have been so supportive of us from our inception. And we're forever grateful. So thank you for having us again.
Of course. So if we can kind of delve a little back into your humble beginnings, where, can you tell us a little bit about, where did you go to school? What made you want to become a doctor? Just a little bit of your background.
Okay. Well, just run through it real quick. Undergraduate studies were completed here in Miami, Florida, at Florida International University.
Nice.
And then I went to Temple University in Philadelphia for my MBA in health administration and worked in that field for about 8 years before I went to medical school. Started at Spartan Health Medical School in St. Lucia, and then I transferred to the American University of Antigua. Finished there in 2010 and did my residency training at Meharry Medical College in Nashville, Tennessee, in family medicine. Mm-hmm. And I board certified for the past 10 years and have been working here in South Florida primarily as a hospital medicine physician, a hospitalist, if you will.
Yes.
And started my practice this August. Oh, wow.
How many years?
Next month is August. It'll be 2 years.
Wow. Time flies.
Years since we started this, and time is going by so fast.
Mm-hmm.
That's a little abbreviated summary of my journey.
I love that. So it sounds like what made you want to go from a hospitalist to owning your own to having your own practice? What was that decision like?
Interesting decision. It wasn't an easy decision because of all the things that you have to do in starting a business in general. But a medical practice has its own unique challenges. But what really drove me was the sense of not being totally fulfilled professionally as a hospitalist, as a family medicine board certified physician who spent many years studying and to reach this level, to really impart your level of compassion and knowledge to the healthcare setting to make patients get better. You do all of that. It just wasn't satisfying for me personally.
Right.
And so I wanted to impart a little bit more of what I worked so hard for into the directly onto the patients. Um, so that was the main impetus for it.
I kind of get the feeling that, if I may say this, your patients are your family. I feel like they kind of have a relationship with you where they want to come back, because I know last time we spoke, it's not just about prescribing the medication. I really got the impression that you're truly concerned about their lifestyle and what happens when they leave your office. And it's not just like, here you go, here's a prescription, you're on your way. So I kind of got that feeling that your patients are more like a family, and I kind of get that impression. What do you do with your patients when they come to you for whatever challenges they have? Like, what would the first visit be like? Is it like
Mhm.
an overview of their lifestyle, or what do you talk about on their first visit?
Yeah, so typically, and your assessment is correct. My patients, officially, our logo is our patients are priority one.
Mm,
But when you think of family, right, that's
yeah.
most of us, our priority is our families. And
Yes.
so, um, what I've mentioned previously is that typically on the first encounter, I want to get to know the patient. So I usually
Mm-hmm.
start with the social history. Where are you from? Where are your folks from? What
Nice.
kind of work do you do? What do you enjoy doing? And then we'll get into some of their medical history, and really engage with them. And I want to know who they are.
Right.
That's going to help me communicate the treatment plan to them,
Mm-hmm.
right? Because that's how we're graded. We're graded by listening and coming up with a diagnosis with that sincere listening coupled with our knowledge,
Right.
and coming up with a treatment plan that fits them, right? And then seeing to it that the treatment plan gets fulfilled and carried out to a conclusion, which in this case would be wellness,
Right.
right? And so when you want that for yourself, you
So
naturally,
true.
and by extension, want that for everyone else. And I take it as an honor for someone to trust me with their health, making decisions and advising them on their health, which is one of the most important things, if not the most important thing we have. One of the most important things we have is our physical health, because
Absolutely.
without it, very difficult to
Right.
do anything.
Our health is our wealth, right? As they say.
Yes.
So important. So, what are your typical, or not, maybe not typical, but what are you occurring? What do you see occurring with the common patient? Is it high blood pressure? Is it blood sugar levels? Or what do you see as the predominant issue nowadays?
Yeah. So good question. I feel though blood pressure is always a culprit.
Mm,
And I don't play any games with it, because you always inevitably you'll see patients who are walking around undiagnosed with high blood pressure
wow.
very frequently
Mm-hmm.
across all age groups and even demographics. And so this is something we can catch, and we see this routinely. But what we currently see often right now is the weight loss, right? The
Yes.
the drugs for weight loss, the emphasis on wellness and fitness, and eating clean food, right? We never even thought to even what
Right.
mention such a thing when we were speaking about food a few years ago. But there's all of this push now for wellness,
Yes.
anti-aging. We see a lot of this now. But weight loss, I would say, if I were to have to pick one up, is probably the number one thing that we're seeing.
Do you prescribe Ozempic, or what are the different weight loss medications? Do you prescribe them if needed? How does that work if somebody has a
Right. So
wants weight loss?
I kind of set myself up for that one.
I think
But
so.
Yeah, but no, I don't. I've been asked, frequently to do it, and I haven't seen the research. To me,
Okay.
hasn't we don't really have all the evidence. I
I
don't
like
feel
that.
as though we do. It's off label for weight loss.
Okay.
These Manjaro is another medication. These medications have been shown in some research studies to bring about weight loss as a secondary benefit, but primarily they're to treat type 2 diabetes,
Right.
which itself is brought on by poor choices when it comes to eating. Now, there
Right.
is a genetic component to it. We can debate to what extent that is a contributory factor. But
Mhm.
there's no debate about it's the poor choices that we make in terms of
Right.
what we eat and how much we eat and the lack of movement in terms of living a sedentary lifestyle. That is a big culprit. So that being said, I feel like that's the solution, if you will, should be geared towards
I agree.
those things.
I agree because the medication doesn't necessarily, in my opinion, doesn't necessarily help change the lifestyle. I believe where your office takes an integrative approach, and I believe you talk about lifestyle and diet and exercise and eating healthy and clean and all the components that are necessary to maintain a weight loss, to achieve and maintain that weight loss goal.
Yeah,
Yeah.
100%. Yeah, and we're trying to really change how we view health and how we view going to the doctor. The experience that we're trying to, as I mentioned, in there's certain parts of the world, people go to the doctor when they're healthy to figure
Right.
out how to stay healthy, as opposed to us. We make poor decisions. We're running around. We work too much, stress too much. We don't spend enough time with our family. We don't spend enough time doing self-care things. We
Mhm.
don't read as much as we used to. We're just all being bombarded. All these things affect our health.
True.
So
Agreed.
it just seems like a common sense approach when a patient comes into our office to at least understand that they're coming with all these potential things rather than
Mhm.
a diagnosis of X. Here's a
Right.
pill for this. See you next time. It's just
Right.
too impersonal, and it
Agreed.
doesn't really encourage the kind of change that we want that will bring about real health.
And us as patients, we want to be able to connect with a doctor where we're speaking to them and we feel that they understand, our experience, what we're going through. And like you said, help a stressful lifestyle, working on the run. We don't take time to do whatever reading, meditating, all the things that contribute to a healthy lifestyle. So it is important for us to be able to connect with a practice like yours. Dr. Moyenda, I was going to ask you about supplements. What are your thoughts about supplements? I hear a lot of people are deficient on D3 and they don't even realize that. What are your thoughts on that?
Yes, very true. I have again a mixed approach, mixed viewpoint with this. Um, just a quick plug. We recently started IV hydration and
Oh, I love it.
yes,
Nice.
and vitamin therapy as well. So we've had our first, and we're doing this in the home. We're
Oh,
going out to
okay.
the home and doing it. So it's very convenient, and people are really liking it. So particularly for our patients who having problems staying hydrated or having a balanced
Mm-hmm.
meal for whatever reason, this is becoming very useful for them. D3 we found to be very low during COVID time because
Yeah.
a lot of us were sequestered inside. We weren't getting a lot of sunlight. And
Right.
again, back to our diet, vitamin D is not one of those vitamins that is produced by the body. We have to get it from exogenous sources, sunlight being one of them, and from food sources, dietary and the like. So I've recently added it to our panel and found that surprisingly, a lot of people are, if they're not low, they're definitely insufficient in terms of their
Oh,
levels, being
we're going to
between
take a
20 and
quick commercial break and we're going to come back and finish talking about the IV therapy. We'll be right back, everybody. Okay.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in to You and Your Doctor. Today we have Dr. Zaki Moyenda, and you can reach him directly at 954-774-1414. He's right here in Lake Worth. The address is 220 South Dixie Highway, Suite 4, Lake Worth, Florida, 33460. And also you can check out his website, moyendamedical.com. Thanks for coming back, Dr. Moyenda. We appreciate that.
Thank you.
So we were discussing, I'm super interested. I love the IV therapies. And you're saying now that you're able to go to your patient's home to deliver that service?
Yes, we're doing that now.
Nice.
2 weeks ago, we're doing it on the weekends for right now. It's very convenient. People are not at work. They have the convenience of their home.
Sure.
And a lot of the drip lasts maybe 15 minutes. We also have B12 infusion, as well as the intramuscular injections. People find that very helpful for decreased energy levels and the like. We're happy to offer that. But back to your question,
Yes.
if a well-balanced diet is in place,
Yes.
right, in terms of, you have your variety of your fruits and vegetables, your high quality protein, and good carbohydrates, etc., and staying away from a lot of the harmful foods and drinks, then supplements may not be necessary at all, especially if you're otherwise healthy.
Okay.
Right now, if you have some medical conditions that affect absorption, some of the GI diagnoses, for instance, celiac disease or something like that, or if you have kidney insufficiency, renal insufficiency, where you can't excrete, you have some other medical condition that will probably demand that you eat a certain particular type of food, then that's different. Then maybe you need supplementation to kind of augment what you have going on. But a balanced diet really doesn't call for the need for any type of supplements.
Makes sense. So you're
unless again, if you some people have weight gain, or they have muscle joint pain, and they want to take supplements to improve their joint health and things of that, targeted supplements, that's different as well. So it's kind of a loaded question, but
of course,
depending on how you want to analyze it.
And I'm sure it's on a case-by-case basis. You treat every patient individually. It's not just a one broad brush where you give everybody the same thing. And so that's the beauty of seeing you, because you can figure out what's going to be best for the patient.
Yes.
So let me ask you, Dr. Moyenda, what type of insurance are you accepting at your practice? If anybody who's listening and they want to know if they can see you, are you accepting all insurances?
Well, we're on most health insurance plans, thankfully. We're on, of course, Medicare and Medicaid.
Oh,
We're
good.
on Aetna, Cigna. We're on Devoted, and
Oh,
we're
good.
on Humana and United Healthcare for out-of-network benefits for PPO options for those two. So we have a wide variety of health payer options that we are contracted with, thankfully. So it kind of widens the amount of patients that we can see.
Absolutely. And your hours, just so I can go over that, you're Monday through Friday, 8 to 6 p.m. And then Saturday, Sunday, I see by appointment only. So you're,
Well, not Sunday yet. We may
oh,
open up one
Saturday.
Sunday a month later on, but right now it's just Saturdays.
Okay, got it. Saturday by appointment. But that's still really good because most people, if something happens on the weekend, they have to go to like the emergency clinic or something.
Correct.
So at least you have that opportunity to be
Yeah,
able,
Saturday hours, 8 to 2, are very popular, especially for our working class folks.
of course, of course. So what have been some of your success stories? I always like to talk about, success stories. Maybe you had a patient come in with their blood sugar levels or their blood pressure or something. What kind of success story can you share with us where you actually were able to help the patient maybe with the overall lifestyle and everything included?
All right. Okay. So are we okay with time here?
We have 5 minutes, so we have 5 minutes.
All
You can share as much as you'd
right.
like.
So our success stories are always kind of relative. They may not always give us the result or outcome we would think. I mean, if we're saying success, but I always say the one, and I'll bring up another recent one, wasn't as happy of an ending, but it was still success in some regards. But we've had patients who have had hemoglobin A1C numbers, which is this is a diagnostic lab tool that says if someone has diabetes and if so, how
Mm,
uncontrolled. And 6.5 and above is diagnostic of having diabetes. And having it 9 or above, the industry says that you should be on insulin.
wow.
So I had
Okay.
a patient whose hemoglobin A1C was literally 14.
Wow.
And we put him on a treatment plan. Of course, we did do oral meds, but we didn't do insulin. Put him on an oral plan, gave him heavy diabetes education in terms of what foods he should be eating, how he should start exercising a little bit, this and that and the other. Bottom line is, came back in 3 months. This was the time period in which we retest this particular lab value, and he was under 7.
Wow. That's
You know,
amazing.
so and this is not the first time this has had. This actually happened to me the first time when I was a resident in residency training.
Okay.
So it is doable to treat people, but this is why we connect with them because they're more likely to follow the treatment plan.
That's the
You know, and
key.
that's the very important key. The other one, real quickly, I'll just mention colon cancer is something we screen for. They moved the age down from 50 to 45 because we're catching it more. But I had a patient come in and he just had one symptom, or actually two symptoms. He had vague abdominal cramping for about 9 months, 10 months,
Mm.
and some weight loss, right? And to me, I literally said, "This is colon cancer until proven otherwise."
Oh, wow. Yeah.
And so we sent him, and he had no other. I think he has high blood pressure, but nothing
Mm-hmm.
else. Relatively young, and it was unfortunate that the diagnosis was positive.
Mm.
But I also say it was positive that we were able to find
That's
it. He
right.
was able to get into the hospital, colonoscopy confirmed it, biopsy. He's in treatment now, and we're praying for him to have a full recovery, and to have no metastatic spread of the
Mm.
disease. But again, these are especially for us men, we don't communicate as much when we go to the doctor. So I try to make everyone feel comfortable. So they will tell us, he may
Right.
have thought this symptoms was nothing, but it ended up being something very significant.
Yeah. That's amazing. That you really I guess, like you said, it's colon cancer till proven otherwise. In other words, you were going to do all your tests, you were going to do the whole workup, whatever you needed to do to figure that out. So they're lucky to have you there. So yeah, we actually have 1 minute left. Is there anything you want to share before you go? Time flies, and wanted to be able to
Yes,
give
indeed.
you the. Go ahead.
Well, thank you again. I will just use this opportunity to invite those who may be looking for a different primary care experience. We do have a hybrid practice, hybrid office, meaning that we have a bricks and mortar
Mm-hmm.
office in downtown Lake Worth, as you mentioned, 220 South Dixie Highway.
Mm-hmm.
But I also do concierge medicine. I have a concierge practice where I see patients in all over, mostly from Boca to Jupiter. And I also have privileges at most of the hospitals here, and I also see patients in the long-term care facilities. And I do home visits. So I'm an old-fashioned family medicine physician, care deeply about my patients, care deeply about restoring health, and if you're healthy, getting even more healthy. And again, if you're looking for a very personal, warm primary care experience, we invite you to come to Moyenda Medical Associates, and you can get us at 954-774-1414.
Thank you so much, Dr. Moyenda. The time has
Thank you.
come. We are complete. Thank you for sharing. It's always a pleasure to speak with you.
Likewise. Thank you
Take
so
care.
much.
Thanks.
Thank you.
Bye.
Okay. Bye-bye.